Hello, everyone. What an exciting time we have for you in store for you today. I'm Dave Bradshaw, and we have special guests here in the studio to talk about a very special event and some of the other things that are surrounding this event at Person Memorial Hospital for the Community Health Fair coming up in the near future. And I want to introduce, first of all, on my right and on your left, as you're viewing the TV screen, is Pam West Williams from Person Memorial Hospital. She is Business Development Director, Physician Liaison, and Physician Recruiter and Marketing Person. Hello.
Hi. Thank you very much
I'll
for
give you a
having
few more titles before we finish.
us. Yeah, that kind of happens.
And beside Pam is David Shoemate. David, glad to have you, Doctor of Physical Therapy and Director of Rehab Services at Person Memorial Hospital. Welcome.
Thank you, sir.
So glad to have you with us. And to my far right and to your far left is Sergeant Mark Massey of the Person County Sheriff's Department, Special Operations Narcotics Unit, who will have a hand in the Community Health Fair Day. And first of all, I just want to say to Pam, to my immediate right, Pam, it's so special to have this event take place again. Thank you for the opportunity for the citizens of Roxborough and Person County to be able to take advantage of this special day. Thank you.
Thank you very much. We wanted to bring it back. It's not all about the hospital. It's community efforts too. We have the Sheriff's Department with Mark and his group, and then every department kind of showing off their skills and actually help the community. These are all free things that will be done.
Right.
Free assessments to kind of help the community. So we're very excited to finally have it back.
I remember those in the past, and they were very successful and so appreciative. People in the community really appreciated the hospital reaching out like this and doing some of the testing and some of the educational and informational sessions that are available. And it's all compacted into a good schedule, and you can kind of pick and choose what you would like to do. Since David is right in the middle, we're going to move over to him and talk to him a little bit about some of the things that will be taking place in his area, the range of motion and strength testing. I guess I said that right.
That's correct. That's correct.
Give us some idea of what some of the things that'll be taking place.
So what I am proposing for my staff is
Okay.
to educate the community on things that they may not be aware of, that they may have deficits, but they live with them, they are compensating with them. But as we age, those deficits then become safety issues. So one of the things we're going to do is provide some strengthening screening, where we do a upper body strengthening assessment, a lower body strengthening assessment. One of the things not on here is we will also do a balance screen, just so people can see small balance issues. Sometimes people's leg lengths are a little shorter on one side, which causes you to teeter-totter a little bit, and as we age, that becomes a balance problem. And so my staff are going to provide that free, and just screening tools, just to give people some awareness of some things that they may want to try to get checked out, just to kind of get a tune-up on the body. So yeah, that's something that we want to make sure we provide.
I guess one of the key words is awareness.
That's right.
Some people may not realize one condition or another, but just by bringing something to light would be very helpful, wouldn't it?
That's correct. And the reason why this will be very good for the community is, even when we are looking at visitors who come into our hospital, oftentimes my therapist will see a visitor who may be having trouble walking down the hall with their spouse, and we may give them some just a few little tidbits that will make balance better. They may be wobbling or whatnot, and we'll just give them little tidbits of how to make them safer. And that same information is something that we're going to provide at the health.
Everyone is so proud of your area at the hospital and the things that you have to work with, and you have a pool and
That's correct.
And excellent equipment. We're blessed to have this unit at the hospital.
I appreciate that, and And being the only rehab center in the community that has a heated pool, it helps us with people who have back problems or joint problems, where being on their, weight bearing causes pain. So we use the pool to offset that, and we can be effective.
All right.
All right.
The facility, the rehab facility is very nice. It's state of the art. Anything that they've needed, the hospital has provided. It has its own entrance and exit where you don't have to go through the hospital. These people aren't sick, so why bring them through a hospital? But kind of if they want to come and actually tour, the rehab center, I don't think a lot of people know it's there and haven't
that's a good
had the
point.
opportunity to come down there and see it, because it's a beautiful facility, and David's staff is awesome. I mean, they're very good at their jobs, but they're really nice people. I mean, I truly like them, on top of being good providers. A lot of speech therapy for children is provided there. His staff is really great.
We talked earlier a little bit about cardiac
Right.
rehab, which was so important.
That is so important, and to be able to come out of a surgery,
Yes, sir.
on your heart, and be able to learn how to deal with those deficits and improve, is something that we're proud to help the community.
Right.
And Pam spoke about our children. We also work with children as young as 6 months old, helping them with little small developmental issues that they may have. And so my team, I promote a stance of every patient that we work with, we treat them like our own family. And so if you can do that, you're going to give that added little extra to get them better. So that's our approach at Percy Memorial.
I love that feeling. That's wonderful. Well, I'm gonna move over to just a minute, talk to Sergeant Mark Massey. Person County Sheriff's Department is going to have a special role this day. And let me say first how proud we are of the Sheriff's Department we have in Person County. The whole team down at the Sheriff's Department. You guys and ladies do a wonderful job for us, and we appreciate it. You're very much to be thanked.
Thank you, sir. When Ms. Williams contacted me, and as a representative of the Sheriff's Office, to come up with some ideas of things we have, the Sheriff's Office has many community programs that we can incorporate. And just to name a few that we're going to or have available there at the health fair at the hospital, the first one's going to be the Identikid registration program.
Wonderful program. Yeah.
It is. We're going to have Sergeant Cheryl Hughes and Sergeant Emily Tingen there. They're going to be conducting, and what the Identikid program is free, and anyone that brings a child or kid at any age, of youth, can come, and the officers will then take a picture of them, get all their demographics, listen them into a computer, and give them a nice printout to have at home in case of an emergency or anything comes up. Something quick to have. It kind of applies to the hospital, or if they're sick, put their allergies down, and that way, if emergency services personnel needs to come in contact with this child and can't communicate with the child, the parent can have that readily available there for them to just hand that card over or information over, and it gives us a lot of known information right there that parent in a moment of distraught doesn't have to come up with those answers. They just have the card readily available. So that'll be one of the programs that we'll have available at the health fair.
All right.
Another one, which is more of my area of training, so is going to be drug awareness.
Yes.
And drug awareness on several different levels. We'll have a few things there for the illicit drug awareness, but also drug awareness as far as prescription medications and the diversion of those prescription medications at all levels. That's an ongoing thing, and it'll be education all the way from physicians or folks at the hospital all the way down to the youth level, where we'll help them identify what may be in grandma or grandpa's medicine cabinet.
Yeah.
And then also offering education to the elderly people or adults that may have those medications that they're not using anymore, and making them aware of how dangerous that is.
Absolutely, yeah.
And how readily available that we have Operation Medicine Drop. The sheriff's office has a 24/7 medicine drop box that person can anonymously go, put those leftover prescriptions in, forget about it, and then it'll be handled. The sheriff takes good pride in having that there readily available at the disposal of the citizens of Person County. So I'm
so glad you're doing that. Probably many people in Person County had a prescription and they, for some condition, and they started taking their medicine and they didn't do what they were supposed to do, is take all of it, and they have maybe 6 pills left in a bottle, and it's been in the medicine cabinet for 5 years, and that's a danger area, isn't it?
Absolutely, and not necessarily that it may go into the wrong hands, but it's possible that it could go into the wrong hands, and that's what we want to make them aware of, and the problems that we face in law enforcement and dealing with those diversion of the prescription medication at all of those levels.
Pam, it's great to have him there.
It is.
It is.
You know, from a person who has a 14-year-old, a teenager,
Yeah.
you know, just the education on his part and making it, you know, he does go into the schools and he does do some of that, but from a parent's level, I don't get to see that, and it's nice to be able to take them by that table and say, you know, you need to look at this, you need to understand. So I think that is awesome to have them there to educate them and us parents.
Just the amount of knowledge that is going to be disseminated that day is just amazing. And in a second, why don't we just kind of scan down the list and give our viewers and those listening on the radio some idea of some of the other educational and informational sessions or seminars or that will take place. You want to cover some of
Yeah,
those?
the OR, this one is kind of fun that they do. Dr. Alan Chapp, who is our general surgeon, and our OR team, they actually have, well, I guess it's the CPR dummies. Laparoscopic surgery, as you know, is like the less invasive. That's what that's standard of care. We try to do that whenever possible. They will take that CPR dummy and put candy in his belly, and they'll let anybody, adults and kids. The kids really loved it. And they try their hand at laparoscopic surgery, and they can see it on the TV, and they get the candy out of the CPR dummy's belly, and you know, kind of let them understand what laparoscopic surgery is and why would they do it. And Dr. Chapp will be there to kind of explain what he does and, you know, why you can do it here versus going anywhere else. I mean, we do have wonderful OR facilities. They're state of the art. There's nothing there that's not kept up to date and state of the art. Gastroenterology, the same situation. People will be there to educate. They also do surgeries there. Dr. Gilmer with Triangle Orthopedics will actually be there doing education on bones and orthopedics. And that plays into hand with David. They work hand in hand a lot. His patients usually go straight to David as soon as they're done. They kind of will go together. Medical records, how to obtain your medical records. Every department at the hospital will have a station and a table. They can come and ask questions. Acute coronary syndrome education, that'll be with Dr. Tori Bratcher. She will be doing education on heart. Person Memorial is getting chest pain accredited by the cardiology of the United States. There's a whole thing on it, but we're going to educate the people of Person County on what to do in those cases, and Dr. Bratcher will be on hand to answer any questions and help.
This is so good. This is so good.
Person County Home Health and Hospice will also be there, and the other health departments or
Share
services.
their role.
They'll share their role, and we'll work together with our case managers when people come in and they're very ill. We're going to have aorta screening. That's where they do the little thing. That'll be free to check the blockages in your neck.
That's the amazing part. It's free.
It's free. Bone density
Thank you,
screening.
hospital.
Bone density screening. The lab will be doing. It's the lipid profile, your cholesterol, and things like that. For the kids, this is mostly for the kids. Well, they'll teach. Quality will be on hand to teach them how to wash their hands, and they'll get them to wash their hands. They'll put it under black light, and they can see where the germs are. And then they'll go back and teach them how to wash their hands properly to get all the germs off. Then we'll have strength and range of motion testing.
Duke Life Flight coming in?
Duke Life Flight in the fire department, so that's
Okay.
really cool. Mr. Torrane is graciously going to help us with Life Flight and bring that stuff in.
Needless to say, this is just a special event. There are going to be some giveaways and some things for the children and healthy snacks. Can we touch a moment? You and I were talking earlier. Just touch a moment on this program called My Health Point at Person Memorial Hospital, and maybe you could touch on that just a little bit.
This is a CMS. It's kind of required by CMS, but we are doing it. We kind of jumped the gun and made sure we get it done. Anybody that comes into the hospital, you have access to your medical records up from when you come in to you know, the rehab services that you do. You sign up online, and we have people there that will help you sign up. We'll have laptops. When you're in the hospital, they help you. You can go online and get access to all your patient records. You can see what your treatment is. I mean, if you have to go somewhere else or you just need to know or want to know. And we will have somebody doing this that day too also.
Oh, wow.
And David may be able to speak more about this as far as your records and things like this that are kept on, housed there. It's
So-
all confidential.
Right. So one of the things that's very important, and a lot of the community always want to know what's being written about them in the medical record
Okay.
and what the results are. And so oftentimes family members who are concerned about a parent or sibling, they want to talk about it. And the best way is this new system
Right.
where you can log in together and look at it and
And it's
view.
all
It's all
confidential.
confidential and it's happening in your own home. One of the things I would encourage the community is, even with our aging adults, is if they don't have an email address, try to obtain one with a family member, because becoming involved with the computer, because that's what this is all about, is being able to have that at your disposal with the computer. So if you don't have an email address as you age, get a child or a family member who does, and try to register so you can get access to all your information. And so it's very, very important.
It is very important. The date is April 26th, and it's 1 to 5 p.m. And I remember in the past, it was crowded.
Yeah.
There's some wonderful displays, and as we mentioned, some free things. That's always a good word to use, and gets people out. But just the services and the testing and the information alone should motivate many people to come and to thank our hospital for providing this day.
Thank you. Well, we're doing it on Sunday. Our staff kind of spoke and talked, and even Mark, sometimes, even though you grew up here and you know it's there, we have a 60-bed extended care unit, which is a fully licensed
Right.
nursing home. And on Saturdays, all of us, you kind of run your errands, you do whatever, but on Sundays after church, a lot of times, that's when people come visit people that are living in that nursing facility, and that's when they have time. So we decided that Sunday was the best day, because it was the day that they would normally come out anyway and wouldn't have so much on their agenda to do. So this would be the better day to do it.
And I'd like to add to that.
Yes, sir.
On that extended care unit, the hospital has allocated about $1 million to renovate the area. So
Wow.
they're gonna,
1.6
How
million.
nice.
and so
How nice.
they're gonna really, the hospital's really putting resources into improving the hospital's patient care to the community. And then the other thing I'd like to add is, because of all this free testing, I'd like to encourage everybody in the community to come out, because with healthcare and co-pays and insurance the way it is, these little small tests would end up being an expensive route if you're
Yes,
trying to
sir.
go through your insurance.
No question.
We have an
Yeah.
opportunity to do it free, to get an idea where you stand, and I would encourage everyone to participate.
It's a wonderful opportunity. And I guess there are occasions when someone does testing, they find out there is a deeper need that needs to be attended to one way or the other.
That's right.
And it actually shows, it shows the things that we're doing at the hospital too. Unless you're sick, you don't always come into the hospital, so you don't know until you need it.
Yeah.
We are just put out the press release that we are putting $2 million into an MRI.
Right. Right.
That we will have full-time. We right now have a mobile unit that's only 3 days, but they can see the construction starting on that. A lot of what's going to be done on the ECU is for rehab rooms, for the short-term rehab people who have, something to go health wrong and they need to stay in the hospital a little while longer, and those will be rehab units that David will work with and get those people back.
And
The goal is to
rehab
get
is
home.
temporary, so it's not going
Right.
to stay. You
No,
come
yeah.
there temporary to get patched up and get on
There
back
you
home.
go.
Yeah, to build up your
Okay.
strength, and those rooms, a lot of that will, on the ECU, will be dedicated to rehab, and that the goal is to get them back home, to get them strengthened up and get them back to where they were.
Look for this information around town, and you certainly can leave some here at our studio. We have a lot of people in, and also you have a website.
www.personhospital.com, that will be on there also.
in case you're new to the area. And, wow, I just want to keep talking. There's so many good things, and it seems like we just got started, but my goodness, thank you. Thank you for this opportunity that the hospital is giving. It's a Duke Life Point Hospital, and we appreciate the service and the opportunity to have this community health fair back.
Thank you, Mark and
Yes,
David.
Mark.
For,
Mark and David.
for
Mark,
doing
David,
it.
Mark, thank you
Thanks, sir.
for your part. And Pam,
Thank you.
Pam is an organizer. I'm telling you, she gave us all kind of notes and information. One of the easiest interviews I think I've ever had to do, because Pam is thorough, and I appreciate that in you. And we really do love our hospital, Person Memorial Hospital. How long has it been here? Since
1945.
45, yeah. We're so proud. And I was telling Sergeant Massey a while ago, before we went on camera, it's one of the diamonds in our community. The hospital and the college, we have so many diamonds in our community. I like to use that word, and a hospital is just an absolute gem.
I think that, I think as far as education goes, in trying to educate the public and come out and meet our doctors, we'll have a lot of doctors on that day.
Yeah.
Our doctors, people tend to think they have to go to Duke to get, and Duke is a trauma center, and we don't want to compete with them. There are certain things that need to go there, but you can stay at home and not have to go so far away. These are very well-educated, well-trained people that work here because they want to. They want to do community medicine. They don't want to work in a big academic center.
Right.
They're great people. We have a great group of providers.
And more than all, we treat people like family.
Yes.
I'm going to remember that for a long time. I'm telling you. Well, we hope we've given you just enough information to get you motivated and to come out and to thank our hospital for this special day. And we thank all our guests. And we hope we'll do this again soon in some other area.
Absolutely.
Person Memorial Hospital Community Health Fair, April 26th. It's a Sunday from 1 to 5 p.m. over on Ridge Road. And again, it's personhospital.com
Correct.
website. Please feel free to check that out. And again, thank you all for
Thank
being
you.
with us today.
Thank you.
All right,
Thank
have a
you.
good day.
Thank you.
Thank you. Thanks for watching and listening.